All right. Good afternoon, everyone. Thank you for joining us today for the Role of Traditional Healthcare Providers in Community Care webinar. Happy Black Maternal Health Week 2024. We are kicking off a day early at IB Black Girl for this special webinar that's catered to our healthcare workers and partners. My name is Jessica Ehule. I use she, her pronouns, and I'm the Birth Justice Program Director at IB Black Girl. I will be hosting today's webinar and starting off with a little introduction. But the bulk of this webinar will be presented by Dr. Monique Liston, the founder of UBUNTU Research and Evaluation that is based out of Milwaukee. We are happy to have them in partnership on today's webinar to talk a little bit more about what we believe community care to be and how you all as traditional healthcare providers can embody that in practice. So very quickly, high level, I just wanted to give you some background about IB Black Girl. We are the only reproductive justice organization based in the state of Nebraska. We center Black women, femmes, and girls, and our work is highly inspired by Bell Hooks, Audre Lorde, and other Black feminists. We really are moving for transformational change at the intersections of gender and race. We do this in a number of different areas. I define this as kind of like our pillars of work. The work that we're centering today is our birth justice work, and that's the work that I lead here at IB Black Girl, and we are addressing many of the disparities that we're seeing in birth outcomes and creating new systems that work for Black birthing people. We also have our catalyst work that's really centering entrepreneurship and economic justice, really thinking about how we can build the Black economic base, understanding the historical implications as well. We focus on Black leadership as well through Black youth and Black femmes and girls. You all may have heard about our Black Girls Lead event that is coming up later this month. We have a Black Girls Lead in advocacy. So if you know any young people that might want to be a part of that event, I highly recommend sending them the registration link to be a part of Black Girls Lead in advocacy. And then the last pillar of work that I'll mention is policy and advocacy. And I always say that washes over all things here at IB Black Girls. So you will hear from our policy and advocacy team from that big P policy level, like at the state legislature, but also thinking about how our partners can change their policy internally to work better for communities and systems. Oh, and I'm sorry, I need to go back one slide. On this slide, I just wanted to give high level a little bit around our approach, especially as it pertains to birth justice. We are looking to build a movement across the state of Nebraska to address the inequities, trauma, and violence that we're seeing in maternal health care. And so we are doing this through building partnership with community-based organizations such as ourselves, but also with those bigger systems that have had historical impact on communities. So if you think about government systems or university-based systems, how can we collectively come together and work together to transform what we're seeing and really hit a space where we are reaching equity in our birth outcomes? I pulled out a few different strategic components of how we are doing this in our birth justice work. We want to expand culturally relevant care. So that's looking at not just your traditional healthcare providers, absolutely those OBs or midwives that are working within hospital systems, but also what can community-based care workers or community-based birth workers also do to help us expand access across the state. So we're thinking about doulas and lactation consultants and other types of birth workers working in conjunction with our traditional healthcare system to really build an integrated system of care. The next one that I wanted to point out is just expanding access to resources, to quality patient-centered comprehensive reproductive and obstetric healthcare. And so thinking about what people may need access to, we know we live in a state that is primarily rural. How can we make sure that people have access to the resources that they need? What could that look like? And being really creative and innovative in how we design that access to care for folks. The last piece that I wanted to mention is one piece that I think will be really transformative in our work if we can find ways to do this, but we want to collect and disaggregate maternal and reproductive health data so that we have a better understanding of what is happening across our state. With that understanding, we can then create strategies or interventions that are addressing the really like root causes of what we're seeing in our disparities across birth outcomes. So I think that one piece, if we can get that down, we would really see some major changes in the state of Nebraska. All right, this slide, I just wanted to use this as kind of like a segue into Dr. Mo's presentation. Um, we talked a bit about kind of like our approach to this work and the way that IB Black Girl has been framed as a full organization, but how we are in space with community is really important. And so on this slide that's entitled How We Be the Community, these are ways that we actively practice community care here at IB Black Girl, how we embody it really. And so the first thing that I wanted to mention is we are rooted in practices of reproductive justice and organizing. So if you think about the frame of reproductive justice work, this allows us to address systemic oppression to ensure that people have the access to reproductive health care and rights that they would desire. Reproductive justice is rooted in an organizing framework as is, and it is an integral part of reproductive justice. And we're using really just a collective action frame. So we really are trying to use that collective action frame for change overall in what we're seeing in our outcomes across the community. So I would say just being rooted in those practices are one of the ways that we are being in space with community. The next thing that I always like to mention is that we're moving at the speed of trust. We understand that there have been historical traumas to our community, and we want to help build the bridge between our community as a community-based organization and some of the systems that have intentionally and unintentionally caused harm. And so doing so requires a lot of intention, a lot of care, and you cannot move fast when you're building trust. And so we understand that, and we move at the speed of trust to be in space with our community. The next thing that I would mention is power building. We are really leveraging the inherent power of community to make change. You will see us oftentimes do this as an organization within our policy work, but the power is in the people, as we say. We are not necessarily giving the power to the people. The power already exists. And so we want to center that in how we make change, whether that be in policy or any other ways, really thinking about how are we ensuring that we are giving even the power that we hold back to community in ways that are really intentional so we can see change over time. The fourth way that I would mention is that we center our community, and you can see this expressed through our values. So we are Black-centric, we are audacious, and we are bold. We focus on Black women, girls, and femmes. And we do this knowing that by focusing on this population that has been historically pushed to the margins, we can impact systems change for all. We are audacious leaders. We amplify the choice of amplify our power and choice. And we do this by building space for one another. So really thinking deeply about how we're creating our space and how we are going into spaces and influencing them so that we in our community feel safe and welcome. And then the last thing that I would mention for our values is just that we're bold. We come as we are. We encourage people to come as they are as well as we try to impact change in our community. The last thing that I mentioned is demonstrating care for our community. We do this in everything we design. So if you look at some of our events, even the other event that we have planned this week for Black Maternal Health Week, it is a self-care and pampering event for Black birthing folks. And that is just a space for them to come and be. That is demonstrating care, that is demonstrating value, that is expressing beloved community, if you will, to them in a way that lets them know that they're important and they're cared for, and we're not asking for anything in return. And so that's one of the examples of how we are demonstrating care. We are creating space for people to be. We are letting folks know that they are valued. We are wanting to hear from them and trying to think about how can we be that bridge or that lever to really making big P and small p policy change. And what can we do to them? We are really servants of our community. So that is how we demonstrate care for community. And we believe that it is the role of all of us to demonstrate care for community, including you all who are traditional healthcare providers, to actively participate in community care. And so with that, I will turn it over to Dr. Monique Liston to introduce herself and talk a little bit about how you can practice community care as traditional healthcare practitioners.
Thank you so much. So excited and honored to share space with one of my most beloved organizations, IB Black Girl. As Jessica stated, my name is Monique Liston. I am the founder, chief strategist, and joyful militant at UBUNTU Research and Evaluation, located in Milwaukee, Wisconsin. And we are more than partners, more than sibling organizations in the struggle. We are kindred family, UBUNTU IBBG, working together since 2020 in a variety of projects, particularly around support in evaluating and research and strategic thinking related to reproductive justice work. So excited and honored to be here today. The purpose and goal and intention of our conversation, because I hope we have a chance to engage today, is about how do we think about community care as healthcare practitioners, healthcare providers, and our ability to transform the system. And I think it's important to just lay the groundwork of saying the system is working as intended. And as the system continues to work this way, we have a lot of people who aren't getting the care that they not only need, but deserve. And because of that, people with the role of healthcare provider, healthcare practitioner, have the unique honor of figuring out ways to provide care and transform the systems that care is provided through. So excited about this conversation, and we're going to hold a collective question throughout our entire conversation today. As practitioners, as providers, how can we integrate community care into our professional practices to create meaningful and sustainable transformations within maternal health systems? Now, this is getting specific about maternal health because this is Black Maternal Health Week, but there's no way for us to care about maternal health without thinking about the whole system. So everyone has something that they could be thinking about as it relates to integrating community care into professional practice and creating meaningful and sustainable transformations within the system. Okay. So I want to start with um, a little honor and tribute to one of the most amazing Black women to ever walk the earth. That is Dawn Staley. And as a Black woman who had played basketball, identified as an athlete throughout her high school and college years, I hold a special place for Dawn Staley, Lisa Leslie, Cheryl Swoops, Rebecca Lobo, these pioneers in women's basketball, remembering the genesis of the WNBA, remembering the first WNBA game being televised. All of that is deeply seated in how I think about and consider myself as a woman, as a leader, as a Black person moving throughout this world. And so, if you managed to avoid the news over the last week, you didn't hear that the University of South Carolina Gamecocks took home the national championship and the Final Four this year under the leadership of Dawn Staley. And this is Dawn Staley's third win at this level, making her the most decorated Black woman, Black person, Black head coach in college basketball, right? All of that alone is worth why we should talk about her. But I wanted to share this clip at the end. This is the post-game interview, as in the game, she still got her Gucci jacket on. You see the net around her neck, and she is talking to the commentators post-game. And so I want to share this little clip that she when she shares a little bit about herself.
No, Coach, I wanted to take a moment and talk about how emotional you were. And we heard Holly talk about it. We in the media have dubbed this as the revenge game. But I was privy to some information about maybe the previous attachment that Cleveland had emotionally in your life. Do you mind sharing what that is?
I do. I used to come to Cleveland Clinic twice a year when I had pericarditis. Dr. Klein, when we flew in, he texted me. He said, good luck and everything. I think he might have been here. He's the pericarditis specialist that when I was diagnosed with it, he was my second opinion. And it was during COVID. Actually, it wasn't during COVID. It ended during COVID. It happened in 2017 during our first national championship. He wanted me to just sit down and have a coffee. And we're on this national championship run, and he wants me to sit down and have a coffee. He said, if you don't, then you're going to have open heart surgery. So I stayed in the middle in that I allowed our assistant coaches to coach him up a little bit, and because I wanted to be there for the ride. But Cleveland Clinic serves a special place in my heart because they treated me when I didn't know what was going on with me. And then, quite honestly, I lost my mother on the way back from Cleveland Clinic on August the 10th. So it's a special place in my heart. I'm glad that it etches a national championship in my heart because my family and basketball are all a big part of who I am, and we share in the success of our family.
So I shared that because she is talking about the opportunity of being in Cleveland. And she's at Cleveland, and Cleveland holds a special place in her heart because she had been cared for at the Cleveland Clinic. And I think it's important in our conversation about community care, about the way she was cared for, because she said, first, on my way landing into Cleveland for this game, I received a text from the doctor that said, good luck. So here you are talking about years later after you've been treated by this, you have the doctor still engaging with you, letting you know that I know what's important to you. Because she says toward the end, the two things that are important to me are family and basketball. And here you have a doctor reaffirming what's important to you by letting you know, I see you in this moment. I appreciate it. I'm so glad that you're here. This moment means a lot because we know where you've been. We know what it's taken for you to be in this space with us. And so welcome back under a whole new set of circumstances. I share that because at the core of being able to provide this kind of care to the Dawn Staley was being able to understand who she was. Understanding who she was as coach, as athlete, as basketball player, and being able to create a care plan around that. Now, I did some more research around this time. She slightly mentions this, but this happened in 2017. And so she had just gotten her job at the University of South Carolina after working at Temple for all these years. And while she was there, she developed this condition. She was feeling weak, and she considers herself a lifelong athlete. She is over 50 years old and still runs practices, as in running up and down the court, doing the same weightlifting as her college athletes does. So the idea of sitting down was like, who are you talking to? I do this. But she was able to be in such a care position that allowed her to navigate something that was frightening, that was scary, that was terrifying, that was life-threatening on her terms in a way that actually addressed the needs of her being able to move through the world as she positions herself. And so the question that comes for me from this is, one, as a provider, do you understand who you're caring for, who they are, not who you want them to be, not who their chart says they are, but who they actually are? And then with that, do you understand who you can be to them? Right? Not just a provider that one time, but someone who can support them on that life journey. So, moving to our first core question, I'm wondering, who are you? If you're thinking about someone caring for you, what identities are most important for you that they should know about? For Dawn Staley, it was understanding that I am basketball and family. Those are the things that are most important to me. Anything that we're doing in terms of my care need to address, be aligned with my concerns and priorities around family and basketball. So I'm asking you in the chat to share one or two things that are like, if you are to care for me, here's what you need to know. Share one or two things in the chat that are like, you got to understand this if you're going to care for me. I'll give you a second to think about that. I know for me, if you want to care for me, you need to know that I run a business. I run a business, and I run a business that is deeply connected to community. So not just a business, but a business that's deeply connected to community. Number two, eating is probably the reason why I'm alive. So food and delicious food is going to be healing and motivational for me, and I need to be intellectually stimulated. Otherwise, I will see no desire in engaging a thing. So keep me curious, keep me fed, and understand that I have a business to run. Then we in a good space. I see from the chat we hear family, we have faith, we have fitness, we have another mention of family, in particularly their role in the family. So we have a mom here, and what does it mean for me to be able to show up for our kids? And I think that's important for us to consider throughout this community care. Like, are we aware of who we are right now as we understand it in that relationship to others? Providers play a special role when providing community care to provide an external lens of understanding who a person is and who they are in relationship with the communities that they're a part of. And so being able to be engaged that way is really, really important. So today, in thinking about Black maternal health, we're thinking about community care, public health liberation, and you as three components towards building, creating, supporting, sustaining healthy individuals and communities. So I know many of us have probably heard the term of community care, but Jessica and I sat and thought and mulled over what that meant for us as UBUNTU and IBBG in partnership for Black Maternal Health Week. And the definition we landed on is community care is a collaborative and holistic approach to promoting individuals' health, safety, and well-being while considering their community's broader social, economic, political, and environmental context, right? I was sharing the story about Dawn Staley with a friend, and she remarked, she was like, this is just another example about Black women making sure that the world keeps turning. No matter what they got going on, they're like, but this thing is happening, and I want to make sure that the world continues to spin. And it's not to say that the world will stop if something happens to one of us, but it's to understand what integral pieces we play to making sure that the world continues to spin. I mean, to her credit, this same year, her team won a national championship. So there might be something to thinking about the ways in which she cared for herself, the lessons learned, and being able to be in a space of community care, not just for herself and her family, but understanding her coaches, assistant coaches, being able to play a specific role in moving things forward. So this collaboration holistic approach is serious for our community care work. So in thinking about community care, we'll think about the world without community care and with community care. And so I'm sharing these two. These are anecdotes that are just synthesized from real experiences that our organizations has had a chance to learn about in our work with IBBG, and thinking about this in terms of community care. So without community care, this is the story. In Omaha, Nebraska, Ty, a young expectant person, found themselves navigating their pregnancy journey without the crucial support they desperately needed. Ty faced financial struggles and lacked a strong support system in their community. As their due date approached, they felt overwhelmed and isolated, unsure of where to turn for help. Despite attending prenatal appointments at a local clinic, Ty felt disconnected from their healthcare providers, who seemed rushed and impersonal. They longed for someone to listen to their concerns and provide guidance beyond medical checkups. One day, while browsing the internet, Ty stumbled upon a flyer for a community-based prenatal support group. Excited by the prospect of connecting with other expectant people and receiving additional support, they eagerly attended the next meeting. However, upon arrival, Ty was disappointed to find that the support group had been disbanded due to funding cuts. Feeling defeated, they returned home, resigned to face their pregnancy journey alone. As their due date approached, Ty's stress and anxiety continued to mount. Without the community care they so desperately needed, they struggled to prepare emotionally and physically for the birth of their child. On the day of their delivery, Ty arrived at the hospital feeling scared and unprepared. Despite the best efforts of the medical staff, they felt disconnected and unsupported throughout the labor process. After giving birth to a healthy baby boy, Ty was discharged from the hospital, feeling overwhelmed and uncertain about their future as a new parent. They longed for the sense of community and support that they had been missing throughout their entire pregnancy journey. And again, this is not an individual story. This is just a synthesis of stories that we have heard throughout our work around this. But I highlight the story in this way because this isn't any one particular isolated harm. No one actively went out of their way to harm Ty. And a lot of times when we have these communications, talking about community care, people want to focus on isolated incidences, as in, did somebody say something? Did somebody do something? In here, you got a medical checkup, went to prenatal appointments. There were people there at the as medical staff supporting on the day of delivery, but the fact that all this was happening wasn't enough for Ty to feel like they had what they needed in order to begin this journey as a new parent. And so this isn't about the simple, like, am I providing decent care? Did somebody harm them while they're receiving care? This is about, are we thinking about Ty as a whole person? Are we understanding their needs besides the medically necessary ones in the moment? Are we understanding where connections and disruptions might occur? And the example about the prenatal support group isn't about that community-based organization not being able to hold such a group. It's about, what does it mean to be an advocate as a healthcare provider and making sure these spaces are funded, protected, and something that are accessible and offered to the pregnant folks who come in and out of their offices. As you can see here, Ty found this on the internet, stumbled across it. This was not something provided to by their provider. So if we're thinking about the same story with community care, here's what it sounds like. In Omaha, Nebraska, Ty, a young expectant person, found themselves navigating their pregnancy journey with the unwavering support of their community. Despite facing financial struggles and lacking a strong support system initially, Ty discovered a network of caring health providers who rallied around them during this crucial time. Early in their pregnancy, Ty connected with a local community organization that offered comprehensive prenatal support services. Through this organization, they attended weekly prenatal classes led by compassionate healthcare providers and community volunteers. These classes not only provided Ty with valuable information about nutrition, childbirth education, and postpartum care, but they also fostered a sense of camaraderie amongst expectant people in the community. In addition to attending the prenatal classes, Ty was paired with a dedicated community health worker who served as their advocate and mentor throughout their pregnancy journey. Together, they developed a personalized care plan that addressed Ty's physical, emotional, and social needs, ensuring that Ty felt supported every step of the way. As their due date approached, Ty felt empowered and prepared for the birth of their child, thanks to this unwavering support in their community. When the time came for delivery, Ty arrived at the hospital surrounded by a network of caring individuals who stood by their side throughout the entire labor process. After giving birth to a healthy baby boy, Ty returned home with a newfound sense of confidence and resilience as a new parent. With the ongoing support of their community, Ty knew that they had the resources and encouragement they needed to navigate the joys and challenges of parenthood. Now, this story here, it makes people smile. This story here lights up your thought processes. This story here is like, this is why I do the work that I do, right? And so when we're talking about the role of healthcare providers in providing community care, it's the difference in Ty's experience. It's not simply about, did you have the medically necessary services needed in order for you to get through labor and delivery. It's about being able to feel supported, to be able to develop confidence, to be resilient, to feel encouraged, to feel prepared. These are the things that we're talking about that community care gets us to. So we're holding this story, right, as we consider what is the role of providers when we do this work. So we got community care. Now we're going to connect to public health liberation. What is public health liberation? You might have heard of the term before, but it's a framework that has been put forth in public health to direct our attention to the broader societal issues which impact health outcomes. So you're considering, like was mentioned in the story, the social, economic, and political determinants of health, and to better understand and confront the root causes of those disparities. This means that we have to actively challenge oppressive systems and advocate for change, not passively, actively. Just like in the story, it's not about, okay, that's over there. You can use it if you want. But it's being like, hey, did you know that this is an awesome program? Do you need any of this support? Are you ready? Are you prepared? Do you feel supported? That's active. And so being in an active position and understanding both challenging the oppressive systems and addressing harm, which is a conversation that we're into a lot in the healthcare profession, but also about advocating for necessary change, as in what additional needs or supports could we better be providing for folks when they need something. Embracing public health liberation requires us to adopt a holistic approach to our practice. That means we're recognizing intersecting factors that shape health outcomes and advocate for policies and interventions that promote equity and justice. Some examples. If we're thinking about equity, we're thinking about, are we advocating for sliding scale fees, free clinics, being able to be in a position to support volunteerism, make sure that access was there. You know, in the story, in the without community care, Ty didn't have the opportunity to go to the program because it was underfunded. But with community care, it wasn't just that it was funded. Healthcare providers worked at the space directly. And so they had access to healthcare providers within the community-based organization. We're thinking about empowerment. We're thinking about, are we actually supporting individuals and having personalized care plans that align with their values? Do they feel like they're a part of the decision-making process of their own health decisions? Thinking about community engagement, we're talking about, are you seen? Are you visible? Are you accessible? In another conversation with Dawn Staley, an interviewer asked, why are you so successful? What do you think it is? First, she talks about her support from her spiritual community, her alignment with what she calls God. She talks about that unapologetically. But second, she says, we are open and accessible to our community. Anybody in our community can knock on the door and say, can we come watch practice? We are in the community. We are visible. We are accessible. We are present. And that is super important for us to galvanize the support that we need to be the best team that we can be. This being a mutual act. The more health providers, including the institutions they work for in the community, the better their outcomes will be as healthcare institutions. This is a mutual effort. It's not giving. You don't just give to the community. If you work with the community, you're able to have better outcomes that are mutually beneficial for the community and the institution. This engagement is mutually beneficial. We're talking about liberation, promoting health equity, and this includes housing, transportation, other things that intersect with what it means to engage the healthcare system. And of course, being conscious of intersectionality, where we're thinking about there's unique challenges that are faced by folks who have that are marginalized with multiple identities. This particular week, we're thinking about Black women, the impact of race, gender, class, and sexuality, and how that can pose challenges for people engaging the healthcare system. But we're also thinking about, how does that work for everybody experiencing multiple oppressions at the same time that we might not have engaged before? And what does it look for us to create a more accessible and affirming healthcare experience for those folks? That's the work we're thinking about as providers. So we're moving from community care, public liberation, public health liberation, and now we got to think about you. At the center of all of this, transforming systems. Transforming systems is only possible if we think about the people who make the systems run. The system itself means nothing on paper unless we are conscious of the people who make those systems run. So that means we got to have a conversation with ourselves. Who are we? How are we showing up? In the worst situations, the most challenging ones, the only thing that we have control of are ourselves. When we're tired, when we're exhausted, when we're thinking that the system is unsurmountable, the thing that we can work with is ourselves. And even if we're engaging this opportunity and we're like, well, what do we do? Where do we go from here? Again, it can't be passive. It has to be active. And that requires, and if we're doing this work, do we understand that accountability only comes from us being able to do it? All of this is about how you show up as a practitioner. So I people want to say, think about, consider, well, what does that mean? What does it look like? So from my research, specifically focused on the healthcare field, we're thinking about the ways in which we actually have a chance to affirm a sense of dignity for everyone. So I'm putting a pregnant person here at the center, but we know that every single pregnant person comes with a set of people, community, all of these things around them. And we have to be conscious of how we affirm a sense of dignity through that. Do we dignify the relationships, the relationships that they're in or not in? Do we make sure that there's dignity in how we consider, talk about, engage around such a thing? Do we talk about their merit in terms of the work that they had to do to be able to be who they are? You know, we think about people being late for an appointment and like, oh, I got to keep my schedule. But do we understand that some people had to make sure that someone was watching the other kids, that an elder was cared for, that they took off of work, that they have enough money for bus fare, that the bus came on time? All of this had to be negotiated in order for them to show up on time versus myself, someone like me, who's like, the difference between me being on time and being late is whether or not did I eat my breakfast or drink my coffee fast or slow. But are we giving enough merit to the folks who are bending over backwards, moving heaven and earth in order to show up, instead of penalizing them because they're not on our schedule? The dignity of excellence, assuming and affirming that every pregnant person who is walking through is doing the absolute best that they can, and that they want the absolute best, not only for themselves, but for their children as well. Are we assuming that? Is that our baseline of consideration? Are we giving them the dignity of identity, understanding that some people, it means nothing to me for you to tell me that I show up as a woman? Because to me, the words Black and woman are one. That is one. I am a Black woman. So when it move through the world, I want to be identified as such. We also think about this in terms of people with trans and queer identities and making sure that they are affirmed in this space. No matter what we think, their identities being affirmed are important. And access, of course. Does everyone have access to what they need in order to have the best circumstances? Not the okay ones, not just the trackable ones, but the best experience. That's the type of dignified experience that we, the you in the previous slide, have to be concerned of in doing. And all of this requires, if we go back to our definition of collaboration, being able to understand what collaboration looks like. Moving from the networking of collaboration through the very thorough, sustainable collaboration. Networking is being able to just say, they're over there, right? That's it. Just know that it exists. Cooperation, which is great, allows us to understand that we understand a little bit about each other. But we want to get into these last three if we actually want to provide the community care that folks need and deserve. Being coordinated, being very clear on who is taking who in what ways, what support is needed, what gaps and opportunities exist. Making coalitions where we're beginning to share ideas and resources to meet certain goals and objectives. And collaboration means we move as one band and one sound. Our communication and characterization of our approach is defined by trust. Shout out to IBBG and moving at the speed of trust. If we do that together, we're able to get to an integrated sense of decision making where the community feels at one with these systems as opposed to opposition with these systems. We got to think deeply about partnerships. And are we doing all of the groundwork necessary before we throw the word partnership out there? I know a lot of healthcare institutions work with community organizations and they want to call it a partnership just because they know the name of somebody. But a partnership requires some work, some groundwork to be laid so that we can scope and build what it means for us to partner. So we can think about the maintenance of our partnership, managing it, thinking about the roles of our partnership. How do we make sure it becomes sustainable? You move into an idea of from what can I bring to what do we do together, right? That's very different. What do I bring? It's very like, I am here to contribute to whatever this is. But what can we do together means we are here to accomplish this. And that's what we want to move into if we're providing a sense of community care. And we're thinking about what happens when we don't, or what's the move from one state of being in community care to not. We're thinking about where a lot of us are, where a lot of our community is in this top portion, this reactive portion, where we're really dealing with a lot of crisis and struggle. In our healthcare term, we're talking about a lot of 911 and emergency room, right? I know that in a lot of communities, because of the relationship to the healthcare institution, a lot of people want to say that this is just poverty, but it's actually also the relationships to the healthcare institution, as in people who are not impoverished. A lot of middle-class folks, especially Black folks, don't deal with healthcare institutions because of the way they've historically been treated there. Because of that, some people's main course of care is in these top three: 911, emergency room, and urgent care. That becomes their primary care provider. Those spaces are crisis, struggle, and barely surviving. They're reactive and responsive to the world as it is. We can get a little bit closer when we start in the thrive space, but we're often in the thrive space because of a chronic condition, meaning we're dealing with the chronic thing, and now we have a series of appointments set up to manage that chronic thing, and we're making it because we are there. But that's merely responsive. What we want to move into through community care is being conscious. When we're conscious, we're able to make strategic decisions, and that is preventative, which is the goal here, right? Then we're thinking about when we're moving into flourishing care. Now we're thinking about just our wellness. Like, now I'm not dealing with what's wrong. I'm thinking about how do I make what's good even better? And then into liberating, public health liberation, community care. This ultimate place that we want to get to is when we're moving with a sense of wholeness. The whole community has this sense of not just care and well-being, but understanding themselves again as one band, one sound when it comes to health decision-making. So as we get towards the end here, we're revisiting this question. How can we integrate community care into our professional practices to create meaningful and sustainable transformations within the maternal health system? We're thinking about our individual roles in understanding crisis, struggle, surviving, thriving, conscious, flourishing, and liberating healthcare delivery. How do we move people from being in that reactive and responsive space with their own health care into the more strategic, flourishing, and liberating? That's what we have to think about and hold on to when we're thinking about all the folks that we're able to serve. And then we're also thinking about, going back here, to the ability for us on the day-to-day basis, provide dignity through understanding the relationships people have, seeing the merit and the actions that they are taking to support themselves and their unborn child. We're thinking about the excellence that we need to assume that they are moving through, that they are utilizing, that they want the best for themselves and their child. We're thinking about making sure that their identities are not just used, but affirmed, seen as appropriate, right, and necessary for who they are and getting the care that they deserve, that they have access to what they need in order for them to move from that crisis, reactionary, that responsive space into this very strategic, flourishing, and liberated space. What can we be doing on the daily basis around that? And then thinking about, as we represent and have the opportunity to have more conversations on the institutional level, what does that mean for us to move into more thorough, intentional, deep collaboration with our community partners? How do we go from just knowing who they are through the networking space to being into a one band, one sound relationship with them? What type of groundwork are we laying? What opportunities are we engaging in order to get that mutual benefit of the most positive health outcomes, both in the community and for our institutions? What are we doing there? And of course, moving into what can I bring? What can I do? Into what can we do together? And how does that challenge the work that we are currently in? How does that position us for new opportunities to reconsider how we're showing up? And then how do we also challenge our systems that are often thinking, we don't do that because I don't know what we would get out of it. We're not engaging in that because we don't understand what we can get out of it. And getting folks out of 911 and emergency room states into preventative wellness and wholeness states. What are we going to do? And of course, we are already taking some actions, but this is us stating that we need to take more actions. More actions have to be necessary if we're taking some actions and we're still in the state that we're in with the outcomes that continue to exist. So the ask about how can we integrate community care into our professional practices to create meaningful and sustainable transformations is because while we might be doing something, we need to be doing more. And so there's an invitation for practitioners and providers to think more deeply of like, okay, here's where we've been, here's where we are, but here's where we still need to go. So with that, I'll open it up for any questions, reflections, or even responses to this question. Absolutely. Assuming folks are moving through excellence, and that's a lifelong thing. And working with parents at any level, any level of their life cycle, we're thinking about assuming that the parents want what's best for them and wants what's best for their children, and that they're doing the best that they can. That assumption will get way more positive engagements and positive health outcomes than the presumption of they're not doing something, the assumption that something is wrong. And I'm not saying there might not be something wrong, but it's just not moving with those assumptions. Actually being curious and grateful for the opportunities to build a deeper relationship so you can understand what is happening, how it is happening, and how it's impacting the health of the child, the health of the mother, the health of the parent in any ways that could be negative or positive. So are we making sure that our focus is on that, is on undoing that harmful assumption and moving with that positive one? Thank you for that. Yeah. And that's something that we all have to be conscious of and work through, because that idea of blaming and shaming over curiosity and gratitude comes up for all of us just as we move through the world as professionals when someone doesn't complete a task. Are we being curious about what's going on, or are we presuming, blaming, shaming? And we need to use that gratitude and curiosity to reframe the opportunity to better understand ourselves. Remember, the answer is always you. It's always you. How can I, as a provider, as someone in this, move with a different sense of dignity affirming, curious, partnership building, relationship centered care? What can I be doing here to better understand my pathway towards it? Absolutely. Thank you. Any other questions, comments, curiosities about the role that healthcare providers could be playing in integrating community care through their professional practice? Absolutely. Thank you, Jaleesa, for sharing that. I think it's so important, especially because care is so locally defined when it comes to healthcare systems, that well, let me speak from a personal experience. because I grew up in the state of Wisconsin, and if you don't know, it's one of the most segregated, highly racialized cities, like many others across the Midwest. Um, and the type of care I received, just assume it's the type of care people get. And then I began to build more relationships with Black women who are of the similar lifestyle and uh, healthcare similarities of mine, and realizing the care that they got in other states and localities was not only different, but much better. And it wasn't until I got to that relationship that I really understood that some of these things are just a matter of people creating the systems that affirm, dignify, build relationships with, are partnership centered. That stuff can happen in these systems. It's not impossible. There's people who are experiencing that across the US, and it is our responsibility to think about how can we be that and better for the communities that we work within. And so that experience definitely was humbling, and it might be like you might not know it until you're engaging the system in this way. Then you're like, oh, this could be happening. This is true, as opposed to just thinking this is unsurmountable or something that could never happen in the healthcare system. It can, it does, and it should be there. It definitely should be there. I'm glad that it's been an experience you've been having that has been affirming as opposed to more challenging. Well, thank you all so much. Um, I will throw this last slide up, making sure that you have an opportunity to follow up and connect with IBBG. And if you have any questions about how you can connect with Ubuntu, there's a QR code that you can scan on the screen, but you can also send an email to IBBG and they know how to find all of Ubuntu at any given point. So we are moving as one band, one sound in terms of partnership in our relationship. But again, thank you all so much for this conversation and engaging. I hope this was helpful. And I hope that everyone has a chance to engage and participate in activities at their respective institutions and communities, so celebrating and supporting Black Maternal Health Week. And I am just honored to continue to be a part of this journey with IB Black Girl. I'll turn it over to you, Jessica.
Awesome. Thank you so much, Dr. Mo. This was a wonderful presentation on how we can all participate in community care. Even those of us in community-based spaces, I think there's always room for improvement and growth, and thinking about how we can all work together better. And it's been a pleasure to always model community care in partnership with you all. And so thank you everyone for participating on today's webinar. Please reach out to us via the modes displayed on the screen right now, and please enjoy the rest of Black Maternal Health Week. We will be in touch. Thank you.